nice to see you all again, even if it is virtually. My name is Kyra Bohlken-Hern, and I go by the pronouns she and her. Before I get started today, I just want to acknowledge that we are located on the traditional territories of the Wasanich and the Kwangin-speaking peoples, on whose traditional territories we live, we learn, we play, and we do our work. So I completed my practicum with an organization called Her Way Home that is located in Victoria, BC. I'd actually first heard about Her Way Home in the PHSP orientation in 2019 and have been interested in the organization ever since. Her Way Home opened its doors in 2013 and is a part of Island Health. Her Way Home is a multi-service, child-focused and women-centered drop-in and outreach program for pregnant women and new mothers who are affected by substance use and who may also be affected by mental illness, trauma, and or violence. Her Way Home offers a lot of different services, but to name a few, they offer pregnancy and postnatal information, primary health care, drug and alcohol counseling, parenting support and advocacy, outreach work, support around current or past abuse, and infant and child services. So due to COVID-19, I completed my practicum completely remotely. My practicum supervisor and I decided that I would focus on 3 assignments throughout my practicum. I would work on cultural safety training, I would create an infographic for Her Way Home, and I would be a part of a committee that focuses on helping to find solutions for gender-based violence within encampments and shelters. So I began by completing a course through Island Health and then by completing a webinar series. This was a really nice way to start my practicum off, and I felt like a smooth transition into my other assignments. I learned a lot of really valuable information during these cultural safety training tutorials. My next assignment was to create an infographic that would describe what Her Way did, who they offered services to, what the services were, what the community impact was, where they received funding, and who they were partnered with. This assignment actually took a lot longer than I had anticipated and took time communicating with stakeholders, corresponding with other employees, and translating knowledge from reports. Here is the infographic. I had to split it into half for the presentation. Overall, I was really happy with how it turned out, and it can now be distributed to other organizations, partners, and funders. About halfway through my practicum, I joined a committee called Sheltering Women and Safety. The purpose of the committee is trying to find solutions for unhoused women who are facing gender-based violence, an issue that has increased since the beginning of COVID-19. As stated by Canada's Minister for Women and Gender Equality, there has been a 20 to 30% increase in domestic violence since the pandemic began. So at the beginning of this committee, we were sort of unsure what my work would be, but it quickly unfolded that they needed help with research and compiling resource lists. These resource lists are now going to be brought to encampments and shelters and turned into posters or pamphlets. I sadly didn't have enough time at the end of my practicum to create these pamphlets myself. Being on the committee was a really incredible opportunity, and even though I was the only student, I still felt like a really valuable member of the team, which was amazing. My practice scenario, I really focused on the importance of health literacy and health communication. Her Way Home offers outreach work, accompaniment, and information and advocacy in order to help women in their programs navigate the healthcare system better. However, what about the women who are unaware that Her Way Home even exists? I definitely didn't before the PHSP orientation. So my practicum supervisor had realized there was very little available information on Her Way Home, and we wanted to change this. This is when she decided that the infographic would be a really useful addition to Her Way Home. A part of health literacy is creating accessibility through print and media, which is something I hope the infographic is able to do. The PHSP guiding value that I focused on throughout my practicum is diversity and cultural safety. Cultural safety played a large role in my practicum, as it is something that my practicum supervisor is really knowledgeable on, and also something she really values in her staff and students. It was especially important to take on this cultural training because 42% of Her Way Home's clients identify as Indigenous. This cultural safety training has greatly benefited me throughout my practicum, but will also be a continued learning experience throughout the rest of my career. So I chose to focus on the TRC call to action number 19. During my practicum, I saw how Her Way Home was striving to close the gaps in health outcomes between Aboriginal and non-Aboriginal communities and to publish annual progress reports and assess long-term trends. As healthcare workers, we need to continue our education in Indigenous healthcare and continue to close the gaps in health outcomes between Indigenous and non-Indigenous people. Once I finish my public health and social policy degree, I will continue my learning on Indigenous healing, continue my learning on Indigenous health disparities, continue my cultural safety training, and continue to strive towards closing the gaps in Indigenous health outcomes and be a good ally. One of the difficulties I faced during my practicum was a switch in supervisor. So the week I was supposed to begin my practicum, I got an email from the person who had originally signed off on my practicum placement, telling me that she had gotten a new job and would be setting me up with a person who had replaced her. I was initially really nervous about this transition and really didn't want to be a burden on the person who was starting a new job and then also throw in a practicum student. However, this ended up being a really amazing experience, and I couldn't have asked for a better supervisor, and we got to learn together through the last 3 months, which was really amazing. The Public Health and Social Policy program has given me the tools to critically evaluate our healthcare system while at the same time giving me all the resources and information to try and be the best healthcare worker I can be. I feel like I've learned incredible skills to take with me throughout my career and feel prepared and confident in my own abilities. I think the PHSP program has created critically thinking and culturally competent students who I believe will go out in the world and make a positive impact wherever they end up. So just to wrap it up, I have a few thank yous. First off, I want to thank all my amazing professors, especially Natalie, who have taught me so much and helped me so much over the past 2 years. Thank you to Betty Taylor for coordinating my practicum and being such a support throughout. Thank you to Sonia Gracie for being an incredible practicum supervisor and for making my practicum placement so enjoyable. And thank you to all my classmates for the past 2 years. It's been a really amazing experience growing and learning alongside you all, and I hope the best for all of your future endeavors. Thank you.